Robotics in orthopedics. We all talking about robotics. It's not a future, it's a present in orthopedics. Robotics have a very great advantage in joint knee replacement and hip replacement surgery. If you see anatomically, our right knee is not same like a left knee. You have so much of difference when we try to do conventionally, where we only depend on the extent clinical examination, where in robotic surgery we do a 3D CT scan, we understand better knee anatomy and we try to get alignment perfect. As I said, the right knee is different from the left knee. It matters antero-posterior and mediolateral, where the sizes are different, the deformity is different. Robotic helps us to analyze correctly and accurately place the implant. Once you accurately place the implant, the alignment will be perfect and the longevity of the implant will be more, and patient will be very comfortable post surgery.